Hi, it's Stuart Hassan, and we're here at the Modern Parenthood Podcast. May is Mental Health Awareness Month, and today I'm glad to welcome back Dr. Kanthi Raju to the show to talk about treatment options that are available to our patients struggling with infertility with stresses, anxiety, and depression.
This podcast is meant to provide information on reproductive health. It does not establish a physician-patient relationship, and we would urge you to contact your treating provider regarding your care.
Before we get started, I like to kick off the show with a patient example. So let's talk about a patient. Let's call her Michelle. Michelle is 38 years of age. She had her first baby 4 years ago. It was easy. They got pregnant naturally. The pregnancy was easy, an easy vaginal delivery, breastfed. Life was good. And now she's been trying to have another baby. She's been struggling with infertility and with also keeping up with a toddler. Her doctor started her on Zoloft, a medication to help with anxiety and depression associated with stress, infertility. So she's here in the office to talk about treatment options. She's done 3 IUIs, so intrauterine insemination, where we put the sperm directly into the uterus, but not pregnant with her second child. She's about to move on to in vitro fertilization. That is where we take the eggs and sperm and create the embryos outside the body. And she plans to pursue pre-implantation genetic testing aneuploidy screening this time. She's 38, her husband's 42. They're a whole lot older than when they first naturally conceived their first child. And so one of the things we're going to talk about today as well is secondary infertility. She has a baby, and you would think, oh, she's happy she has a baby, and if she gets pregnant the second time, great. If not, she has a baby. But our patients who struggle with secondary infertility, it's just as difficult for them as the patient who's never had a child. And it's so important that we talk about this, as well as what treatment options are available. So today I have Dr. Kanthi Raju again with me today to talk about treatment options available for anxiety, depression, and stresses associated with infertility. So Dr. Raju, welcome back to the show.
Thank you so much, Dr. Noor Hassan. I'm again honored to be here and look forward to continuing our discussion about stress and infertility and its effects, and expanding on that with this episode about treatment options. So thank you again for this honor.
Will you tell our listeners a little bit about yourself and what got you into doing psychiatry?
Absolutely. So my name is Dr. Kanthi Raju. I'm an adult general psychiatrist. I've been in practice for over 27 years now. I actually grew up in Mississippi. I did my undergraduate studies there and went to medical school in Iowa. I started out my career training in internal medicine, but then decided that psychiatry was I had more of my passion, and transitioned my training to psychiatry at UT Southwestern in Dallas, where I finished up as chief resident in 1999. I worked as a medical director for a community mental health center for a few years before pursuing private practice, which is where I am now, and really enjoying my time getting to know my patients, connecting with them on a deep level. I like to take a collaborative, patient-centered approach to care, involving my patients, their families, other healthcare practitioners, in hopefully providing a very holistic treatment approach for their symptoms. So thank you again for this honor.
Absolutely. We're going to start off with talking about treatment options available for those struggling with infertility, stress, anxiety, and depression. So let's start off with the patient walks into your door, Dr. Raju, and says, I've been struggling with fertility and stresses, and I'm anxious all the time. I can't stop crying. Tell me, what are you looking for in the history? What are you looking for as she describes some of these symptoms? What are you looking for in the partner?
The initial approach is really to try to understand what the patient is experiencing, what their symptoms are, what the history is, what has happened to bring them into my office. I think also understanding what their idea of stress is. because a little bit of stress can be a very normal thing. That's our body's natural response to something that it perceives as a challenge. And it helps us focus and help us get through difficult times. So a little bit of stress is normal. What is important to differentiate is whether or not the stress has become chronic, because chronic stress can affect our entire bodies, not just physically in terms of having some effects on hormone changes, but also emotionally, how we think through things, our thought patterns, how we take care of ourselves. Are we sleeping well? Are we eating well? Excuse me, are we taking care of others around us? So all of that, I think, is important to address and kind of sort through. Stress can also impact sexual functioning. It can decrease libido. It can decrease arousal. So is that also playing a role in what's brought them into my office? I think it's important to differentiate between a normal stress response and then unhealthy coping mechanisms to that. A normal stress response is being able to manage it and complete the task that you need to do, but unhealthy coping mechanisms may involve not taking care of themselves, poor self-care, not eating well, sleeping well, like I mentioned before. So then we address, okay, let's take a look at your symptoms. Do your symptoms fall into the category of a generalized anxiety disorder? Do you have excessive worry that's affecting your daily level of functioning? How long has that been present? Is it causing dizziness, lightheadedness, muscle tension, changes in sleep pattern, changes in appetite, or because these symptoms can occur together, do you actually meet criteria for a major depressive disorder? And those symptoms involve, of course, an overwhelming sense of sadness on a daily basis, appetite changes, sleep disturbance, feelings of guilt or worthlessness, changes in energy, changes in concentration. Do you feel like you're moving slow through life? Are you having any suicidal thoughts or thoughts of harming someone else? I think all of those symptoms are important to address with the patient, and then also going into what are their coping mechanisms. How do they deal with these symptoms? What have they been doing that they found to be successful? What kind of support do they have at home? And what kind of community support they have? I think all of those are important things to consider.
You touch on something very important, the psychosomatic changes. Oftentimes I get patients who will complain, oh, I have pelvic pain. Oh, I have vomiting or abdominal pain. I can't think straight. I have a massive headache. And it's important for us to realize sometimes the stresses that we're dealing with can also have a significant impact on our daily function. It's the feeling we get when we get up on stage to make a big speech in front of 1,000 people. We get our stomach hurts. We may run to the bathroom numerous times. The stresses that those things bring about, they bring about physical symptoms as well. And it's so important that you mentioned that because it's important that patients get treated for the causation, the anxiety, the depression, the stresses, and to help them understand that, you know, this is something that they're going through. And you brought up also a very important point. What is normal stress? And is this something I'm going to be able to get through? And what is something that's chronic stress and something that really is anxiety and depression? So thank you for clarifying that.
Absolutely. And I agree with you. Yes. I mean, there are physical somatic symptoms associated with stress. There's depression, of course, anxiety, nausea, dizziness, lightheadedness, headaches, muscle tension, sexual dysfunction, appetite changes, sleep changes. And it may not be generalized anxiety. I mean, you can also, patients may also experience symptoms of a panic disorder. excuse me, where they have very physical symptoms of an increase in heart rate or palpitations or chest pain, and feeling like the walls are closing in on them. Some patients may experience social anxiety symptoms where there's some social withdrawal or avoidance of social gatherings or events, feeling judged by others. And then there's also, of course, PTSD, post-traumatic stress disorder symptoms, which involves symptoms of re-experiencing or reimagining a very traumatic or stressful event that had occurred. There's some hypervigilance associated with those memories. There can be some avoidance. There can also, of course, be some physical symptoms associated with it. So it's not just anxiety. There's specific different types of anxiety that are kind of grouped together. And then, of course, there's depression symptoms as well.
You brought up something very important in terms of anxiety, and the increased heart rate, increased blood pressure. They are panicking about the future because they don't know what the future holds, and they cannot control what the future holds. And sometimes they have chest pain. And I take these symptoms very seriously. I've had to send a few patients to cardiologists first. I say, you got to get everything else ruled out first from a cardiac standpoint to be sure that this is just stress related. And it's so important that people understand that the stresses can have a negative impact on our body and on our physical symptoms as well.
That is absolutely correct. And I think you bring up something that's very important in terms of a multidisciplinary approach to treatment, especially for your patients, because it's not just you as their reproductive specialist, but also endocrinologists and mental health professionals and genetic counselors and nutritionists and dietitians. I think it is a very all-encompassing, like I said, multidisciplinary approach to their treatment. So thank you for that.
Absolutely. So let's talk about some of how patients can deal with stress. How do you decide if a patient should do cognitive behavioral therapy? And we'll have you describe that in just a second. And which patients need medication treatments? How do you go about deciding what's right for which patients?
Well, it's definitely a collaborative approach. I think it's important to make those decisions together between a patient and their healthcare practitioner. The threshold for, I think, my approach in terms of treating their symptoms, the threshold for looking at medication is how much of an impact their symptoms are having on their daily level of functioning. I mean, if we are addressing symptoms that a patient's experiencing that is keeping them from being able to work, or they're not taking care of themselves, they're not eating properly, they're completely withdrawing. Of course, if they're having thoughts of self-harm, those can be medical emergencies, and I think at that point we do need to have a discussion about medication intervention. But many patients may have a little bit milder symptoms, and they may decide that they want to take the psychotherapy approach to their treatment, and may want to avoid medications or antidepressants for different reasons. So I think it's that decision between medication and therapy is really dependent on the severity of their symptoms. Of course, studies have shown that a combination of medication and psychotherapy, particularly CBT, cognitive behavioral therapy, is actually more effective than either one of them alone. So a combination treatment approach is actually very ideal.
Can you tell our listeners a little bit about cognitive behavioral therapy? Like, what should they expect?
So cognitive behavioral therapy is a therapy that is focused on addressing cognitive distortions. So this is irrational beliefs or perceptions, oftentimes rigid, self-negative thought patterns or processes, self-critical. And balancing those with more realistic perspectives. So I think the best way to kind of describe CBT is learning how to change how you feel by changing how you think about something. So again, it's about reframing how you think through those cognitive distortions with more realistic thought processes. This can be very effective. It can be short-term. It typically is not long-term treatment. It's a very active approach to therapy, and again, very, very effective. And patients work one-on-one with a therapist who specializes in CBT. It can involve workbooks. It can involve some homework assignments. Again, so it's a very active, dynamic approach to therapy.
You brought up something very important in terms of setting realistic expectations for you as a patient and coming to those thoughts and realistic thoughts and how that improves or how that affects your feelings. It's what I call cautiously optimistic. I tell patients we want to be hopeful and optimistic, but at the same time, understand truly what the pros and cons or what our realistic expectations are for each treatment process. And having that understanding and that thoughtful process really helps with the feeling. So, for example, when I tell a patient, this embryo looks really good, I think this embryo has an 80% pregnancy success rate, versus I tell another patient, this embryo tested great on the PGTA testing, but the grading is just fair quality, and this embryo has about a 10% pregnancy success rate. It's setting those realistic expectations. And so the person who I just told 10%, they understand that thought process of going into this and saying, okay, 10% chance, that means 90% chance it may not work, and it's really figuring out how to understand your thought process. Okay, there's a 90% chance it doesn't work, but I'm going to be grateful I tried with this embryo before I decided on the next step, assuming the next step may be donor egg, and figuring out how to put those thoughts together in terms of realistic expectations. Because if they're not in that 10% that gets pregnant, there's grief, there's depression, there's sadness, and it's how to set yourself up to have the feelings and understand those things. And just like you said, the grief, it lasts for 6 months or maybe less, but you understand what the grief is and then you move on. But that chronic depressive state is where we're concerned about that person and their mental health. And so this is so important that people understand how cognitive behavioral therapy can be very beneficial in terms of getting them through the fertility treatment process.
Absolutely. I completely agree. Studies have determined that women who actually receive additional support in terms of psychotherapy during their fertility journey are actually 2 times more likely to get pregnant. And couples who participate in couples therapy during their journey are more likely to get pregnant too, as well, to have positive results. So I think it is very important. And CBT is, of course, one type of therapy, psychodynamic therapy. There are other types. Another popular one is ACT, or acceptance commitment therapy. This involves it's kind of like improving your psychological flexibility to handle stressful situations. So it incorporates a little bit of CBT along with mindfulness and being grounded, being in the moment. It's actually accepting your emotions, having some cognitive diffusion where you can actually visualize those negative thoughts or cognitive distortions from floating away from you. So this is a very active type of therapy as well. It's, like I said, being present, being mindful, and seeing self as context. And what I mean by that is rather than stating I am a failure, it's saying I see myself a failure, and then addressing how you see yourself. So again, self as context, choosing personal values, what's important to you, what brings you joy, and then you and your therapist make concrete steps to make some changes. So again, that's another very active type of therapy. So you have CBT, you have ACT, acceptance and commitment therapy. Another very popular one and can be very helpful for patients undergoing some grief and loss is EMDR. This is eye movement desensitization and reprocessing. It's a specific type of therapy that is very effective for trauma treatment. It involves pulling up distressing moments and disturbing memories and processing those side by side a visual stimulus, which then changes the way that memory is consolidated in the brain. So it actually becomes less emotionally charged. This is a very short-term type of treatment. It has been shown to be very effective. I believe that there are like 8 stages that you go through in the treatment. Again, very active with the therapist. There's, of course, mindfulness. We had talked about that earlier. That is about being very in the moment and understanding your emotions in the moment. It involves meditation, being grounded. It's not about avoiding emotions. It's about acknowledging them, accepting them, and allowing yourself to experience those and to find a place of peace and calm with those. There's other types of therapy, biofeedback, which involves monitoring your vitals while you're doing therapy. So you're looking at your heart rate, your blood pressure, your breathing rate, your oxygen saturation, and feeling a greater sense of control of those processes and how your thought process can change some of those parameters. And then there's, of course, neurofeedback, which is biofeedback, but also including EEG to look at brainwave patterns during treatment. So, I mean, there's, of course, many different types of therapy that can be incorporated, and all of them very effective for many people.
Which one do you typically start off with?
I believe CBT is more commonly used, and patients are generally more amenable to that because it is a very active type of therapy. Many patients like the idea of having something very tangible that they can work with, like a workbook, or having some homework assignments that they can work on. EMDR is very effective, but it can also be a bit of a painful process in the very beginning. So it does involve the patient getting to a place where they feel very safe in working with that therapist to be able to even pull up some of those distressing memories. So CBT tends to be the more commonly used, and of course it is very effective, and patients are very welcome to it.
I agree with you. With the CBT, having the patients play an active role is very important. Many of our patients are very well accomplished. They've accomplished great things in their career, and they're struggling that they cannot control their fertility. And they're willing to do everything possible, and there's only so much that you're in control over, and then the rest is up to genetics, age, and technology. But giving them a resource where they feel like they're part of the treatment options and part of the therapy gives them a sense of, hey, I'm taking active control over working on this, and I'm an active part of this. So I agree with you. CBT tends to be the most common starting treatment.
Yes. And it's, the access is great, right? So there's, you have even online platforms that are available to patients that to start CBT. So I think given the effectiveness of the type of treatment and the access to it is very helpful.
You mentioned earlier on medications, so prescription drugs that patients can use to help with this as well. One of the questions that I get a lot from patients are, well, will this drug be safe in pregnancy? And is it something I'm going to need to take long term? And how long will I need to take it? Do I have to stop it for the IVF treatment? What about pregnancy? Can you tell me what goes into that thought process of which drugs you select to start patients on for anxiety, depression, to helping them cope with the stresses of infertility, knowing that at some point, hopefully soon, they're going to be pregnant?
I think it's important to discuss with patients, what are their what are they bringing to the table in terms of their thoughts about medications? Have they been in treatment before? Have they had a family history of someone in their family being on medication? What are their attitudes about medication, and what are their concerns or fears or anxieties about medication? I think it's important to explore all of that as we have that discussion. The general consensus is that the risks of untreated anxiety and depression in couples going through fertility treatment is greater than the risks of side effects to many of these medications. So it is best to have healthy mom, healthy dad during this whole process, healthy parent in general. So then we start discussing the different types of medications and what's available, and the side effects associated with them, the length of treatment. So the more commonly medications are Zoloft, like your patient example, and Lexapro. These are SSRIs. So SSRIs are medications that are primarily regulate serotonin levels in the brain to help change symptoms of depression and anxiety. These are considered very safe. They have been around for a long time. Prozac was actually initially developed in the 1980s, but Zoloft, which is sertraline, or Lexapro, which is escitalopram, generally are more commonly used in patients during their fertility journey, with fertility journeys when they have depression and anxiety symptoms. Very well tolerated. Some of the more common side effects may include some nausea, maybe even a slight increase in anxiety initially, but generally those symptoms dissipate over the first week or two. Response time can vary between patients, but most patients see some improvement within that 2 to 6 week period. Studies have shown no effect on chromosomes in the embryo or IVF outcomes using SSRIs. So I think that's important to discuss with patients. There are other medication options. There are SNRIs. These are medications that are dual action. They work on serotonin and norepinephrine. Examples include Cymbalta and Effexor, which can also be very helpful. And sometimes we monitor blood pressure with these medications. And then you have Wellbutrin, which is not the first-line treatment, but can be considered depending on the patient's symptoms and past treatment history, family history. Some antidepressants can affect sexual functioning in terms of decreasing libido, delayed orgasm. So those are some things to consider in patients, especially if, talking about their being on medication during the treatment process or what their history has been in the past. There are other medications such as antipsychotics or mood stabilizers that can also be part of the treatment plan. But it is important to carefully monitor for some metabolic changes that can occur with these medications, such as weight gain, hormonal changes, and some lab monitoring that we might need to do while they're on these medications. But again, these are very important discussions to have between the patient and physician. Long-term benzodiazepine use. Benzodiazepines are medications that are sedative hypnotics. Common examples are Ativan, Xanax, Valium. Long-term use of these medications are generally avoided due to the side effects of the medication and especially cognitive changes that can be experienced with these medications. Cannabis or THC can affect fertility as well in terms of affecting menstruation and ovulation, so that's something to discuss with patients. For men, Remeron and Wellbutrin sometimes can be helpful. They have a little bit less potential for some of the sexual side effects associated with some of the serotonergic agents. So there's a wide variety of options, treatment options available to patients. I think it's important to, again, discuss what their history has been, what their experience has been, what their concerns are, and then talking about side effects to watch for, how long they might be on the medication. And earlier we were talking about treatment, a timeline for treatment. Oftentimes I discuss with patients, let's make a commitment to, once we find the right medication and you're doing well, you're tolerating it well, let's talk about maybe 8 to 12 months. And then depending on how you're doing at that point, we can talk about seeing how you do withdrawing from the medication slowly and gradually. But of course, always paying attention to what their previous history was, length of treatment in the past, and the current response, and what their goals are for themselves in the future.
You bring up such an important point, and thank you for going through the various classes of medical or medication treatments for our patients. One of the important things you just brought up was risk versus benefits, and which medications provide certain risk in terms of side effects versus the benefits. This is an individualized approach. What may be right for patient A may be different for patient B or patient C. And it's very important that people understand where they are in life, and we meet them where they are in life with the treatment that is individualized for their situation.
And medication may not be for them. There are other, we discussed, of course, therapy, but there are alternatives to medication for treatment. There's ECT, which is electroconvulsive therapy. This utilizes an electrical impulse to specific areas of the brain to kind of rebalance these neurotransmitters, these neurochemicals, to relieve symptoms of depression and anxiety. This is very effective. It leads to a very rapid response rate to these symptoms and improvement. But it does require general anesthesia, and there are some side effects of some transient amnesia during the treatment. Another type of alternative treatment is TMS, transcranial magnetic stimulation. This also is fairly rapid in terms of response, and this involves a magnetic field to deep parts of the brain to, again, kind of stimulate or rebalance the neurochemicals. And this is wonderful for patients who may be wanting to avoid antidepressants or medications. This typically involves several weeks of treatment, but of course, it is more short-term course of treatment. There's another type of TMS called SAINT, which is a Stanford accelerated form of TMS, which involves more intense pulses over a 5-day period of time as opposed to several weeks associated with regular TMS. And then you have phototherapy, light therapy, which can be helpful for some patients who are sensitive to the effects of sunlight and dark days and maybe some seasonal affective symptoms. It's very well tolerated. It involves sitting under a bright light with 10,000 lux for about 15-20 minutes on a daily basis. Excuse me, side effects, maybe some eye strain or headache, but again, very well tolerated. And it can be helpful in kind of resetting your biological clock with sunlight. And then digital therapy. So this would involve like apps, mobile apps that can be helpful, or some of the web-based therapy, like I believe it's BetterHealth and Talkspace, excuse me, that can be helpful for patients. Or having a smartwatch that records your sleep patterns and your heart rate and blood pressure and even EKG at times. So there's so many alternatives to medication, depending on what the patient's needs are, what their attitudes are, what they feel comfortable with, and then even acupuncture. Some patients do report an improvement with acupuncture, which involves a very thin needle to specific areas to possibly increase blood flow to help with some of those symptoms. So again, so many treatment options out there, which is wonderful.
I'm so glad we have all these treatment options available to our patients. One of the things, too, I try to tell patients is that they're not alone in this journey. 1 in 6 couples today in the United States struggle with infertility. So look around you. There's a lot of people who are struggling with infertility. So can you talk a little bit, Dr. Raju, about group sessions, Facebook groups, or even getting together in larger groups in-person sessions?
Yes, definitely. Group therapy can be very helpful. The benefits of group therapy is that you don't feel alone. You feel supported. There's education associated with it. There's a sense of camaraderie. Again, it's that support, reducing isolation, feeling empowered by talking with others about how they're dealing with it. There's, of course, you have online group therapy and in-person group therapy. There's benefits, pros and cons to both. Online group therapy is immediately accessible, so and it's very convenient. In-person group therapy, you have the ability to have really deep connections with others with in-person group therapy, and there's, of course, it's less isolative. You can really develop some deep, long-lasting friendships associated with those two if you feel comfortable with it and it's a safe environment. So I think, again, a sense of empowerment, less isolation, connecting with others, validation, it all comes from that supportive environment that's associated with group therapy.
Dr. Raju, tell us a little bit about what our patients go through when they learn that they need donor egg, donor sperm, or surrogacy to continue their fertility journey. I will tell you, it's really difficult for me to break this news to our patients when we have to tell them they need donor egg, donor sperm, or surrogacy. And as part of that as well, I have them meet one time with a therapist to be sure they're comfortable moving forward with that process. The therapist will send me a nice letter that says, oh, John and Jane are comfortable moving forward, and I check the box and I keep moving along. However, I feel like my patients get a lot out of meeting with a therapist. They talk about their feelings about the need for donor egg, donor sperm, and or surrogacy. Will they tell the child that they were conceived via this process? And if so, when? And what about things like 23andMe, and if the kid finds out later in life? There's so many things that go into the psychological component when a couple decides they need donor egg, donor sperm, and or surrogacy. And so tell us a little bit about what sessions are like with those couples. And it's particularly more difficult for me to tell a woman she needs donor eggs because she feels like, oh my gosh, I'm not a woman anymore. I don't, my eggs don't work. Or for me to tell a man that, hey, as a couple, y'all need donor sperm, and his feelings of inadequacy, and now they need donor sperm for him to have children with his wife. Tell us a little bit about what goes on in the psyche of these people and how can we help them getting through this process?
That's a very important topic and something that's very important to address. And I'm glad to know that you really do involve mental health professionals in this process. I think for couples, there's a great deal of emotions kind of mixed up in all of this. There's some, levels of uncertainty and grief and loss is also associated with that. Some anxiety about what does this process mean, like you said, for the child in the future, and how does the couple feel about themselves in this process and their self-esteem, and is everyone comfortable with it? Does everyone feel safe? Is there clarity and stability in this situation, and all of the parties involved? I think that's that's very important to address. I mean, there's also not just the psychological process of it, but also discussing some of the legal complexities associated with it and making sure that everyone is aware of it, they're consenting to it, they feel comfortable with it. So I truly support the the involvement. This is a multidisciplinary approach as well, that we had talked about earlier, in terms of having your physicians, your mental health counselors, your attorneys, your agencies, all involved in this process. So I truly believe that having a mental health professional involved in this process is important.
You're absolutely right in terms of this being a multidisciplinary process when we involve third-party reproduction as donor egg, donor sperm, and surrogacy. And for some of my couples who come from strong cultural or religious backgrounds, they also struggle with, well, what if my parents find out, meaning the grandparents find out we use donor egg, donor sperm, and our surrogacy? And how will we be treated differently in our society, in our culture, in our religion? And that's a big leap for them in terms of coming to terms with utilizing third-party reproduction, and definitely having the multidisciplinary approach where we have attorneys involved and everything is delineated from the very beginning who this child belongs to. Having mental health professionals guide everyone through this process in terms of them being comfortable moving forward in this process. Their physician or their fertility doctor helping them with the reproductive aspect. And this becomes a very big multidisciplinary approach.
Mm-hmm. Absolutely. And like you mentioned earlier, there's also this consideration of what kind of support does the donor conceived individual need on a long-term basis? Is that something that the couple is thinking about as well? And not just for themselves, but also for the child.
It's absolutely important. Today, there are children's books that teach children that they were conceived via donor egg, donor sperm, and or surrogacy. My only child is born via surrogacy, and he knows that his mother did not carry him. But if you look at him and you look at me in the mirror, it's the exact same person. He knows he looks like me, but I never carried him. For us, we told our child from day one that he was born via surrogacy. But that may not be right for every couple, for every religion, for every culture. And how to navigate those situations, those social situations, those environmental situations is really important. And this is very important where the mental health professional comes in.
This is where family therapy can be helpful, through this whole process of, you're right, how do you handle this situation? What do you feel comfortable with? There's no right way or wrong way to it. It's whatever the family feels comfortable with. And there's lots of things that kind of, come to the table with that. So again, I think it's very important to explore all of that, all of those issues and thoughts with a mental health professional.
Well, thank you, Dr. Raju, for being our guest today. Y'all know I like to end the show with debunking some myths, but today what we're going to do is leave you with some hope and support. And so I'm going to ask Dr. Raju to tell us or give us some resources of support for those of you struggling with mental health disorders and infertility. So Dr. Raju, why don't you give us some support IDs?
I will. And I have a couple of things that I actually wrote down so I can make sure that I got them for you. So there are some resources, specifically Resolve, RESOLVE. This is it's a National Infertility and Family Building Association that you can find online. Another one is SART.org, SART.org, which is a Society for Assisted Reproductive Technology, which can be helpful. There are some apps. Tilly, TILLY app can be helpful. It involves some CBT skills in there, meditative exercises, as well as community support. There's also reproductivefacts.org, which can provide some online information. There are many apps that are available to learn some meditative mindfulness exercises. There's Calm app. There's Headspace. There's actually there's a free app from the VA, PTSD app from the VA that incorporates some of these mindfulness exercises as well. There is one thing called PRCI, which is a positive reappraisal coping intervention. This is a self-assessment tool that is evidence-based, and it involves 10 core statements that that a person can read or just kind of say to themselves once or twice a day that you can find to be helpful. And I'm going to kind of read off the statements. The first one is, I can find joy in my life. Second is, this situation is challenging, but I can grow and learn from this situation. The third one is, I am proud of how I am handling this situation. The fourth one is, there are moments of beauty and connection among this journey. The next one is, I will focus on the progress I have made. And the next one is, this experience is teaching me to be patient. I will give myself permission to rest and recharge when needed. I am capable of dealing with whatever happens and whatever comes. I can find something positive to focus on a daily basis. And the last one, I am not alone. I have support and I have my own strength. So those are positive reaffirmations that can be helpful on a daily basis and recommended to do once or twice a day.
Thank you so much for giving us those positive reaffirmations. As you were going through them, I'm like, oh, it's so nice to hear these things. And we need to tell ourselves these things on a daily basis just to make it through the day, whether you're struggling with infertility or anything else. So thank you for sharing that.
My pleasure. Thank you so much.
Well, thank you all for joining us on today's show. And thank you, Dr. Raju, for being our guest. Remember to take care of your mental health, not just in May because it's Mental Health Awareness Month, but every day. And just like Dr. Raju said, positive reaffirmations every day can really get you through what you're going through. If you want to listen to all things infertility, you don't want to miss the next episode, please like, follow, and subscribe.
Pioneer.